So I'll talk about mechanism of breathing. Mechanism of breathing. So what is our ultimate goal when we breathe? We want to inhale oxygen from the atmosphere and we want to exhale carbon dioxide into the atmosphere, right? We need to understand water is H2O, right? So you can see water molecules present. So these water molecules can exert pressure. So similarly, gases in the atmosphere can also exert pressure. So gases in the atmosphere like nitrogen, oxygen, carbon dioxide, and other trace gases, these gases can also exert pressure. So the pressure exerted by all these gases together in the atmosphere, in the pressure exerted by these gases in the atmosphere is called as atmospheric pressure. Atmospheric pressure. This equals to 760 mm Hg. 760 mm Hg. So we all know nitrogen is almost about 78% and oxygen is almost about 21%. So these gases are present in trace amounts. So as we mentioned earlier, the ultimate goal was to inhale oxygen from the atmosphere. So we cannot selectively inhale oxygen from the atmosphere. We can inhale all these gases together, right? So we are inhaling all these gases from the atmosphere during inspiration, and these gases enter our respiratory system, eventually reaching alveoli. From the alveoli, it enters the bloodstream. And similarly, during expiration, carbon dioxide from the bloodstream enters the alveoli and exits the respiratory system and enters into the atmosphere. So this is what is happening during normal breathing. So the question now is, how is this happening? So how these gases are traveling from one place to another place? So these gases, they move from high pressure to low pressure, high pressure to low pressure, right? So this is what is happening during inspiration, right? So in the atmosphere, the atmospheric pressure is 760 mmHg, which is constant. So these gases, they have to move from the atmosphere to enter into the thoracic cavity during inspiration. That means the pressure in the atmosphere should be greater than the pressure in the thoracic cavity. Right here, the pressure has to be high for the gases to move from the atmosphere to enter into the thoracic cavity. Here, the pressure is has to be low. Here, the pressure has to be low for the gases to travel across from the atmosphere to the thoracic cavity. Similarly, during expiration, the pressure in the thoracic cavity has to be high for the gases to travel from the respiratory system and eventually to enter into the atmosphere. The pressure in the thoracic cavity has to be higher than the pressure in the atmosphere. This is happening during expiration. This is happening during expiration. So far we have understood the gases that are present in the atmosphere exert pressure. So that pressure is called as atmospheric pressure, and that is equal to 760 mm Hg. So next we saw how gases move from atmosphere to the thoracic cavity and from the thoracic cavity to the atmosphere. So we need to understand we have atmospheric pressure and the pressure in the thoracic cavity. So I mentioned earlier the pressure in the atmosphere is a constant one, which is around 760 mmHg. The pressure in the thoracic cavity changes, right? Pressure in the thoracic cavity changes. So what happens to the pressure in the thoracic cavity during inspiration? During inspiration, we saw pressure in the thoracic cavity was less than the pressure in the atmosphere. Whereas during expiration, pressure in the thoracic cavity was greater than the pressure in the atmosphere, right? So how pressure changes happens in thoracic cavity. So how is the pressure increases or how is the pressure decreases in the thoracic cavity? How is this happening? So for that, we need to understand why lung collapses naturally, what is surface tension, how the lung collapse gets prevented, what is pleural pressure, what is intraalveolar pressure. So to answer this question, why lung collapse naturally, we need to understand a term called as surface tension. Surface tension. Here you can see, here you can see, this is a glass that contains water, right? that contains water, water throughout, water throughout. The water molecules in the inside this glass will exert pressure in all directions, will exert pressure in all directions. This is basically happening because of the intermolecular forces. So it will happen in this pressure will be exerted by all the water molecules that are present in this glass, right? The only exception is at the topmost layer. At the topmost layer, here pressure is exerted laterally and downwards, laterally and downwards. This upward pressure is absent here since there is no water molecule above. Since there is no water molecule above, all this pressure gets transmitted laterally and downwards, laterally and downwards. And because of this pressure in the lateral direction and downward direction, in the topmost layer, tension gets created, and this tension is called as surface tension. And this tension is called as surface tension. So imagine this is a water body, and this topmost layer has surface tension. We'll take two individual. This is person A, and this is person B. Person B. This person is jumping from a cliff. This person is jumping from a cliff, and he lands like this. This person will not suffer any injury because the surface area here is very low. He can pierce this topmost water layer and can land safely. And if you take this person B, and if he's going to jump from this cliff in an horizontal position, the surface area here is high, and when he's going to hit the topmost layer, because of the surface tension, because of the surface tension, this patient is going to suffer an injury. This patient is going to suffer an injury. So why is this relevant for us? This is relevant for us because in the alveoli, this is alveoli. So these are the alveolar epithelial cells. On top of these alveolar epithelial cells, there is a water lining, right? There is a water lining. And I've told you earlier, this is air in the alveoli, and this is water molecule. This is water molecule. Because of this air water interface, at the air water interface, like in this area, air water interface throughout, you will have surface tension. And because of this surface tension, alveoli gets collapsed. Alveoli tends to collapse. The alveoli that are present throughout the lungs, if they collapse, when they collapse, so the alveoli present throughout the lungs, when they collapse, the whole lungs is going to collapse, right? So this is why lungs collapse naturally. It is because of the surface tension. It is because of the surface tension. So we understood why lungs collapse naturally, and we understood what is surface tension, and we need to understand how this is prevented. How this is prevented. This is prevented by two mechanisms. One is because of surfactant. Because of surfactant. Surfactant is nothing but a lipid molecule that gets produced by the alveolar epithelial cell that basically reduces surface tension. Another mechanism is because of the negative pressure in the pleural space. Negative pressure in the pleural space, right? So now we have to understand what is this negative pressure. I'm not going to talk about surfactant. I'm going to only talk about negative pressure in the pleural space. So the next thing we need to understand is what is pleural pressure, what is alveolar pressure. What is alveolar pressure? So pleural pressure is nothing but pressure exerted by the pleural fluid in the pleural cavity. In the pleural cavity. This is parietal pleura, visceral pleura. This space in between them is called as pleural cavity, and this fluid is called as pleural fluid. So the pressure exerted by the pleural fluid in the pleural cavity is called as pleural pressure. And the pressure here is almost always negative. Almost always negative. And what is alveolar pressure? The pressure inside the alveoli, inside the alveoli is called as alveolar pressure. Alveolar. First, I'll talk about first I'll talk about pleural pressure. Pleural pressure. I have mentioned earlier this pleural pressure is almost always negative, right? So how is this negative pressure gets created inside the pleural cavity? So in the previous video, I've explained how pleural fluid is produced and how pleural fluid exits. How pleural fluid exits. So the fluor, I'll show you again. The pleural fluid which gets produced, they exit via the lymphatic system. They exit via the lymphatic system. So this pleural fluid, when they exit like this, the amount of pleural fluid in the pleural cavity decreases, and because of this, a slight negative pressure gets created. Slight negative pressure gets created. I'll give you an analogy here. Imagine this as parietal pleura and this as visceral pleura, and this plunger is your lymphatic system. So as the plunger is pulled back, parietal pleura and visceral pleura get separated, and because of this, a negative pressure is created in this space, right? So this is what is happening here also. So the lymphatic system, imagine lymphatic system as a plunger, and it keeps sucking out all this pleural fluid out of the pleural cavity, and because of this suction effect, there is a negative pressure gets created in the pleural cavity. So this negative pressure in the pleural cavity which gets created in the pleural cavity prevents the collapse of the alveoli. Prevents the collapse of the alveoli. So alveoli, I'll explain this. I've just taken this one alveoli and I've drawn it bigger here. So here you can see alveoli, and this is the surface tension created, and because of the surface tension created, alveoli is going to collapse. Alveoli is going to collapse. And imagine, because of the surface tension, this alveoli has collapsed. Has collapsed. Now air cannot enter into this alveoli. So how can we make this alveoli bigger or expanded like this? So I'll show you the same analogy here. So this was our parietal pleura. This is our visceral pleura. So when the lymphatic system drains the pleural fluid out of the pleural cavity, so space gets created between the parietal pleura and visceral pleura, and because of this space, here you have negative pressure. Here you have negative pressure. This is what is happening here also. This is what is happening here also. So now imagine you have a glass. Now imagine you have a glass filled with water. Filled with water. And if you put your needle inside this glass of water, what happens is that because of this negative pressure, water gets pulled into this cavity. Water gets pulled into this cavity, right? So this suction effect pulls the water back into the syringe, right? So we'll apply the same here also. So this has collapsed, right? Now we have suction effect created here in the pleural cavity. Created here in the pleural cavity. So this suction effect is going to pull the alveoli and it is going to expand the alveoli. Thereby, alveoli will not collapse. This is going to happen throughout. This is going to happen throughout. So all over you have negative pressure, right? So throughout you have negative pressure, and alveoli that are present throughout will not collapse, rather they get expanded little bit, right? So we'll see the numbers now. At rest at rest air is not going inside or air is not going outside. Okay, so during this phase, atmospheric pressure, which is a constant one, right? Alveolar pressure, which is inside the alveoli, equals to atmospheric pressure. When they're equal, no movement is happening across atmospheric. So we saw atmospheric pressure, alveolar pressure. The next one is pleural pressure. This equals to 756 mmHg. I told you this pressure has to be kept negative. This pressure has to be kept negative for the lungs to not collapse. So in other words, we can write, how can we write this in other words? Pleural pressure is equal to pleural pressure minus atmospheric pressure. 756 minus 760 equals to minus 4 mm Hg. So this minus 4 mm of Hg is what is required for the lungs to not collapse. And this is at rest, considering there is no movement is happening across. So now we will see what happens during inspiration. So during inspiration, I have mentioned in the earlier video, diaphragm contracts. So when diaphragm contracts, volume in the thoracic cavity increases. And similarly, when external intercostal contracts, so you can do this by yourself also. How external intercostal increases the anteroposterior diameter. This is sternum, this is vertebral column, this part is your ribs. They act as a single unit, right? So when external intercostal contract, thoracic cavity goes up like this, and because of this action sternum moves forward, thereby it increases the anteroposterior diameter. So what I'm trying to say is, here is your vertebral column, here is your sternum, this part is your rib, this part is your rib, right? So during inspiration sternum falls forward, and because of the contraction of the external intercostal, this anteroposterior diameter increases, and this diameter also increases, the horizontal diameter also increases. So this is what they say it as bucket handle movement and pump handle movement, right? So because of the increase in volume, overall increase in the thoracic cavity volume, pressure decreases. So there is a law called as Boyle's law, which states volume is inversely proportional to pressure. So when volume increases, pressure decreases, right? When volume decreases, pressure increases. So here during inspiration, thoracic cavity volume increased, right? Thoracic cavity volume increased. So pressure naturally has to decrease. So where is this pressure dropping? Where exactly is this pressure dropping? So I'll show you. I mentioned in the earlier videos the relationship of parietal pleura. So this part is costal parietal pleura, this part is diaphragmatic parietal pleura, and mediastinal parietal pleura, and cervical parietal pleura. So when diaphragm contracts, the part of the parietal pleura that is related to the diaphragm also goes along with the diaphragm. And because of this, the distance between the parietal and visceral pleura increases. So when the vacuum expands, there is even more negative pressure, right? Initially, there was a minimal negative pressure because of the suction effect of the lymphatics, and now because of inspiration there is even more vacuum, leading to even more negative pressure. And because of the contraction of the external intercostal muscle, you can see parietal pleura goes away with the movement, right? So the gap between the parietal pleura and visceral pleura increases, and thereby more negative pressure gets created. So what happened during inspiration? During inspiration, pleural pressure is even more negative. So the pleural pressure is 753, right? So the pleural pressure minus atmospheric pressure, it equals to minus 7 mm Hg. So during inspiration, the pressure here is minus 7 mm Hg. So when the pressure in the pleural cavity becomes even more negative, alveoli opens up even more. Alveoli opens up even more. This was alveoli when the pressure here was 4 mm, 4 mm. And the size of the volume of the alveoli increased because of the increase in negative pressure in the pleural space. And we can apply the same law here also. When volume increases, pressure decreases, right? So here volume is increased, so the pressure here dips. So I've shown the same here also. So at rest, alveolar pressure was 760, atmospheric pressure was 760. So they cancel out each other. No movement was happening. And during inspiration, pleural pressure was even more negative. And because of this, volume of the alveoli increased. Because of the increase in volume, pressure in the alveoli decreased. How much has it decreased? It has decreased to 759. From 7 60, it has decreased to 759. So now the pressure in the alveoli is minus 1 mmHg. So because of this slight negative pressure created here, so air from the atmosphere is going to enter into the alveoli. So this is what is happening during inspiration. So finally, what happens? So finally, what happens during expiration? So expiration is a passive process. When diaphragm relaxes, the thoracic cavity size decreases. So volume is inversely proportional to pressure. So volume, thoracic cavity volume decreases, pressure is increased, right? Pressure is increased. So the pleural pressure goes back to minus 4 mmHg during expiration. The alveolar pressure here is 761 mmHg, which is slightly greater than the atmospheric pressure. So 761 minus 760 is 1 plus 1 mmHg. And since the pressure here is positive, air is going to enter from the alveoli to the atmosphere during expiration. So during expiration, diaphragm relaxes, the chest external intercostal relaxes, and because of the elastic recoiling property of the lungs, the pressure in the alveoli is slightly higher than the atmospheric pressure, and because of this, air exits from the alveoli into the atmosphere. And this is all you need to know about the mechanism of breathing for us to understand what happens during thoracic trauma. Thanks.